I
Fun
guess
for
I fell
Days
asleep on
98.
the steering wheel and just rolled off the road. I was calling home from work during a night shift, and my car flipped and caught on fire. I was in a coma for like 3.5 months, and then like an extra month just waking up, trying to like exercise a little bit. It took me about half a month to start walking again, and then to rehab for 2 more months. That took way longer than it was supposed to be. I went backwards in that rehab place.
Despite the doctor's predictions, his recovery was never going to be smooth sailing.
Should have took less than a month. They predicted 2 to 3 weeks out of it in there and out walking. I went back in the wheelchair and then basically took a lot longer for me to walk again.
After all the rehab stuff was done, there were like 2 years and I wait to see him to see if I should get in a transplant.
I have a colleague who works in New Jersey. He's a plastic surgeon, and he called me to let me know about a patient that he had been taking care of for numerous months. He also talked about the struggles he was dealing with.
This doctor came up with a plan that was also the first surgery of its kind.
I found a New Jersey plastic surgeon, and he recommended Dr. Rodriguez in New York City to testing. It's about a total of 2 years.
He had had numerous operations, probably over 20, his face and his hands, and they began to entertain the possibility of a face transplant or hand transplant.
But how many surgeries did Joe need before he was able to get the life-changing one?
I think I had a total of about probably like 26 to 28 surgeries offhand. Most of them were skin grafts when I was in the coma. A lot of, like all my burn surgeries basically were the majority of it. Then I had some like pre-surgery before my transplant to get ready for the transplant. So I had a couple more surgeries before the actual transplant. And then I had probably about 1 debulking surgery when I was under sedated and then 2 when I was awake.
Even after such a traumatic situation, Joe tries to lead a normal life with a smile on his newly constructed face.
Yeah, I could smile. I could feel all the nerves and like the muscles moving underneath all the swelling. Once the swelling goes down, I could probably do a lot bigger smile, but what's preventing me to show like my teeth and all that with a smile is because of the swelling. But once the swelling goes down, I could smile.
Joe gained a public persona due to his groundbreaking surgery, with him recently marrying his wife, Rachel. However, that doesn't mean his life isn't met without any hostility.
When we go out in public, people do stare. They don't really say anything because I think they're too scared. Sometimes people are genuinely concerned that he is having an anaphylactic shock. I get a lot of hate. He gets a lot of hate about the way he looks. I get hate for being with him, and I'm just so sick and tired of it. We had flown from Tokyo, the TSA officer to give him Joe's ID, and the look on his face was just off. You have a public-facing job. This is what you chose because someone looks different. This was your reaction. We will continue to post. We will continue to share our journey. I think it's absolutely pathetic that this is the world that we live in. I will always call people out for it, and I'll always speak up on it.